First off, I think it's important to know that many patients with systemic lupus can have uncomplicated pregnancies and healthy babies. However, we know that those with active lupus disease activity, those patients are associated with increased risk during the pregnancy. This can include preterm birth, preeclampsia, early cesarean delivery, and fetal growth restriction. We know vitamin D has immunomodulatory properties and that low vitamin D levels have been associated with adverse pregnancy outcomes in the general population. So this study by Medanchi et al. With Michelle Petrie's group investigated the association of 25-hydroxy vitamin D levels and adverse pregnancy outcomes in patients with SLE. So they were interested in looking at the association between vitamin D levels and 3 pregnancy outcomes: miscarriage, preterm delivery, and small for gestational age. So they enrolled patients in their Hopkins lupus cohort that had a diagnosis of SLE, who were all on prenatal multivitamins, which typically contain about 400 international units of vitamin D. And then those who had low vitamin D levels were supplemented with weekly 50,000 IU or daily 1,000 to 5,000 IU as needed to achieve a vitamin D level of 40 nanograms per milliliter or higher. And they enrolled patients from 2009 to 2022, had around 260 pregnancies that they used for this analysis, and the mean Selena SLEDAI of their cohort before pregnancy was 2.5. The study found 45% of patients in this cohort had an adverse pregnancy outcome, and they discovered a U-shaped association between the vitamin D level and adverse pregnancy outcomes. So in other words, those with low vitamin D or high vitamin D levels were associated with having one of these adverse outcomes. So combined pregnancy outcomes or looking at miscarriage, preterm delivery. And these findings do not demonstrate causation. We know there's an association, but exactly why those with too much vitamin D, for example, seem to have this association with adverse pregnancy outcomes is not entirely clear. We know that the impact of low vitamin D levels is associated with adverse outcomes in the general population during pregnancy and even in lupus patients who are not pregnant. However, there's less known about potential consequences of having too high vitamin D, especially in pregnancy. So one of the novel aspects of this study is this apparent increase in adverse outcomes that we see in those with too high vitamin D levels. And so that association is something interesting and novel. The study supports that rheumatologists should really check vitamin D levels and supplement these in our pregnant patients with lupus who have vitamin D deficiency. The authors of the article suggest aiming for a target vitamin D level of between 40 and 59 nanograms per milliliter. And again, watching that the levels don't become too high. I think as rheumatologists, we're often used to checking disease activity frequently during pregnancy in our lupus patients, whether these be serologic disease activity markers or urine studies for proteinuria. And this study suggests we can better optimize our care and provide better care by incorporating checking of vitamin D levels into our workflow in lupus pregnancy patients.